Hi, I'm Elizabeth Dartnell, the Executive Director of the Sexual Violence Research Initiative. The SVRI, with over 8,000 members, is the largest global network working to build knowledge for improved practices and prevention of violence against women and violence against children in low and middle-income countries. Evidence and research builds knowledge that is essential for finding solutions to end violence against women and children. Yet, unfortunately, when it comes to resources for research, funding remains highly concentrated in high-income countries. We at the SVRI are unapologetically committed to redressing inequities in research funding between high-income countries and low and middle-income countries. One key way we do this is through our annual grant-making program, the Sexual Violence Research Initiative Grant, Knowledge for Action to End Violence Against Women and Violence Against Children. This grant-making program has been generously supported by the Swedish International Development Cooperation Agency and Wellspring Philanthropic Fund. With this grant, we support and fund innovative research in low and middle-income countries that is conducted by researchers based in low and middle-income countries to ensure that the solutions presented are locally relevant, contextually appropriate, and effective in improving services and reducing violence experienced by women and girls. And after an extensive and highly competitive process, this year 9 grants have been awarded. We are so excited to share with you the winners of the SVRI Research Grant for 2023. Please meet our grantees.
اسمي عبد اللطيف محمد، أستاذ جامعي باحث بجامعة محمد الأول بوجدة المغرب. أسكن حاليا بالرباط، المدينة التي سيقام فيها هذا المشروع.
I'm Dr. Meg Ryan. I'm a researcher in the Centre for Global Health in Trinity College, Dublin, Ireland. I work in collaboration with Dr. Abdellatif Mamri.
هذا المشروع هو شراكة بين الجمعية المغربية لتنظيم الأسرة، الاتحاد الدولي لتنظيم الأسرة، وجامعة ترينيتي بدبلن.
The focus of our research is to explore and understand Moroccan and refugee women's experiences of reproductive violence.
وهو موضوع حديث الساعة، يتطلب منا المزيد من البحوث من أجل إطلاق المعلومات الخاصة حول تجربة النساء والفتيات بالمغرب في مختلف السياقات الاجتماعية والثقافية.
Overall, this project aims to generate increased knowledge to be able to enhance capacity to provide more sustainable services to those impacted and to advocate for national policy changes.
My name is Loratoma Lucy.
My name is Ariho Foster. I'm a researcher based in the Faculty of Medicine at the University of Botswana.
I am a study co-investigator and CEO of the Botswana Gender-Based Violence Prevention and Support Center, which is headquartered in Gaborone.
I'm leading this research in partnership with my collaborator, Lorato Molusi. The title of our project is Intimate Partner Violence Stigma and Help-Seeking Behavior. Through a partnership between an academic institution and a community-based NGO, we will investigate the role of intimate partner violence stigma and other barriers to seeking help for women who have experienced intimate partner violence.
Estimates suggest up to 37% of women have experienced some form of intimate partner violence at some point in their lifetime. Yet fewer, less than 1% by some estimates, have ever sought help when they needed it.
Through mixed methods research, this study will gather evidence to improve our understanding of intimate partner violence stigma. We will also develop and pilot test culture salient scales to measure intimate partner violence stigma in our setting. We envisage new testable interventions will emerge through these efforts to stimulate future collaborative research.
My name is Sneha Alexander. I work with Medan, a global technology not-for-profit, as Program Manager for the Asia-Pacific region. I will be leading this project with my colleague Shalini Joshi.
My name is Shalini Joshi. I'm the Program Director for Network and Training at Medan. I'm based in Bhimtal in India.
I'm based in Kerala in India. The title of our project is Gender Disinformation deepening perspectives and designing responses.
The focus of our study is to investigate online gender disinformation in South Asia, targeting women, trans, and non-binary people.
These campaigns use false, misogynistic, and sexualized content to malign and discredit women. This project is a partnership between Meedan and the Digital Rights Foundation in Pakistan, the Quint and Chambal Media in India.
The aim of our project is to build a high-quality data set and case studies of gender disinformation in online spaces.
We will also use machine learning techniques to develop models to further detect gender disinformation online. Gender disinformation aims at silencing women and making it difficult for them to safely participate in public spaces and discourses. By highlighting these issues in our project, we hope to change that and contribute to a healthier internet.
I am Dr. Christine Frey. I work at the University of Technology Jamaica, and I'm the country director of the Non-Entry Research Center Jamaica. I am based in Kingston, Jamaica. Our project is called Play, Talk, Change. We aim to break the cycle of child sexual abuse in Jamaica through the newly developed culturally authentic game and associated curriculum activities that will challenge norms, beliefs, and attitudes that fuel child sexual abuse. The focus will be on increasing awareness and facilitating help-seeking behavior for those affected. Our research will help to advance the field by providing new methods, tools, and resources for teachers, social workers, and other professionals to facilitate attitude and behavior change.
My name is Claudia Stoicescu, and I'm a researcher at Monash University, Indonesia. We are working together with Penabulu Foundation, Community Legal Aid Institute, as well as the transgender-led Indonesia Transgender Network, Sanggar Suara in Jakarta, and Kabaya Foundation in Yogyakarta. The focus of our research is the adaptation, feasibility, and effectiveness of a community-engaged intervention designed to reduce gender-based violence, as well as to increase access to justice for transgender women in Indonesia. Our research is important because transgender women experience disproportionately high levels of gender-based violence while facing low access to prevention and support services. The prevalence of intimate partner violence is 2.5 times higher among transgender women compared to cisgender women. Through this project, we will test and adapt the first evidence-based intervention to address gender-based violence prevention and improve access to justice for transgender women globally.
Mi nombre es Daniel Orrego y trabajo en Fútbol Más en Lima, Perú. Nuestro proyecto se llama Jugando Seguros y utiliza el fútbol como herramienta de transformación en niños, niñas y adolescentes. La investigación es importante porque evalúa el impacto de esta intervención que busca mejorar habilidades socioemocionales desde un enfoque de género transformador. A través de este proyecto esperamos reducir normas de género nocivas en niños y niñas y disminuir la violencia de género en relaciones entre adolescentes.
My name is Nwabi Saja Mashai. I am a researcher at the Gender and Health Research Unit of the South African Medical Research Council. I'm based in Pretoria, South Africa. The title of our project is Combining Violence Against Women and Violence Against Children, Strengthening Understanding and Measurement of Adolescents' Experiences of Violence in Caregiver and Other Adult Family Members, Peers, and Intimate Partner Relationships. The aim is to understand adolescent exposure to and participation in violence in close relationships and its associated psychosocial effects, and to develop rigorous and culturally appropriate measures of adolescent violence using an adolescent-led research approach among adolescents in 2 South African high schools.
My name is Pei Song. I'm a researcher from the Center for Global Health, School of Public Health at Zhejiang University. I live and work in Hangzhou, Zhejiang Province. Our project is called Uncovering Adverse Childhood Experiences on the Violence Against Left Behind Women in China, Life Course Pathways and Priority Setting. The aim of our research is to articulate the magnitude, drivers, and health impacts of violence against left behind women through a life course perspective, and to increase understanding of the nature and the dynamics of violence against left behind women in China. This research will prioritize the concerns, voices, and lived experiences of left behind women in the local context. We will also provide an evidence-based priority setting for researchers, policymakers, and the general public.
My name is Savitri Sapkota. I am the Executive Director at Possible, a not-for-profit organization that focuses on research and innovation. I'm leading this research with my colleague at Possible, Rekha Khatri.
My name is Rekha Khatri. I am the Senior Research Manager at Possible, where I work in collaboration with Women's Rehabilitation Center.
We are both based in Kathmandu, Nepal.
Our research focuses on testing a family-based intervention that engages 3 key family members, the woman, her husband, and her mother-in-law, to reduce domestic violence against women and improve the mental health of married women of reproductive age in Nepal.
Our research is significant because it addresses the broader context of domestic violence against women by targeting the family unit, rather than solely focusing on the woman experiencing the violence.
It is also particularly important in South Asia and other low and middle income countries where women live in multi-generational households and face violence not just from their husbands but also from other members of the family, including mothers-in-law.
This research presents a novel strategy that can be implemented even in situations where domestic violence against women is ongoing and where women may be unwilling or unable to leave the relationship.
We hope to contribute to the development of effective interventions that improve the lives of women and families impacted by domestic violence.
Since 2014, the SVRI grants program has provided more than $9 million across 84 research projects in 45 low and middle income countries across the world. The 2023 cohort of studies will conduct research on critical areas to advance evidence on preventing and responding to violence against women and violence against children, and will be guided by ethical and survivor-centred approaches. These studies will increase our knowledge in the field globally and will be shared with communities, researchers, practitioners, policymakers and governments to support change in the lives of those affected by gender-based violence.